Let me ask you a question. Do you really know how much revenue your clinic should be making based on the space you already have? I'm going to show you how to calculate it here with the revenue ratio calculator. Your revenue ratio is the percent of revenue you're currently bringing in versus what you could be bringing in based on your clinic size. See, a healthy clinic should fit around 100 to 125 visits per week for every 1,000 square feet of space. Anything less than 100% on this calculation means you could be bringing in more revenue and collections than you're seeing today. So, why does this matter? Because if your ratio is too low, you're likely dealing with one or more of these. One, which is feeling super busy, yet revenue's still tight, or cutting budgets for things that could actually grow your clinic, or staff stress and retention issues because compensation can't keep up. So, to fix that, you need to start by knowing your numbers. And here's how to use the calculator below. Let's take a look. All right, so right here on our website, we've got our revenue ratio calculator. And as I scroll down here, we'll get to the calculator part. So all you gotta do here is plug in how many square feet you have for your clinic. And if you have more than one clinic, you can do it per clinic, and then you can do it as an aggregate with all clinics and total square footage. So let's just say I have a 2,000 square foot facility, and my average revenue that I get per reimbursement per visit is about $85 per visit on average. And so I can punch in here how much my clinic's making. Let's say I make about $700,000 a year. Well, off of that amount there, my ideal patient visits per week is 250 patient visits, and so I'm not hitting that. And my annual revenue ratio potential, based on my square footage, is about $1.1 million. And so you can see here, there's a difference between that 700,000 I'm currently making and that potential of 1.1 million in this clinic space. And so that gives me a revenue ratio of 63% and a difference of about $400,000 I'm missing out on. So there's definitely room for me to work on things here to get better. If your revenue ratio came out lower than expected, don't panic. There are usually three key levers that you can pull. One is getting more new patients, and maybe right now your marketing isn't generating enough consistent demand, or the conversions are terrible, or you're just not discovered online, but getting more new patients. The other part is more team capacity. You might need to hire or better optimize your provider schedules. Or you might need higher paying patients. That could mean going after premium insurers or more cash pay patients or adding cash services to your mix. The solution is often a mix of all three. And the exact mix will look different for you than another clinic, even of similar size. So, how do you know where to start? And that's exactly why we created the Market to Grow practice strategy. You can get access to that full video training or my book below. And if you're running a clinic with 3 or more providers and you're ready for advanced marketing systems that give you clarity, consistency, and control, then go ahead and schedule a free 45-minute strategy session with one of our marketing consultants to see if our done for you services are the right fit. But again, if you haven't already gone ahead and calculated your revenue ratio, then go ahead and do that. And then explore below how you can get closer to your clinic's full 100% revenue ratio potential.